Not anymore. Registration is now open for the Desert AIDS Walk. This year's theme, Walk Out Loud. The walk is scheduled for October 29th. We're really excited about it. It'll kick off bright and early, 9 a.m. beginning in Ruth Hardy Park. We really want you to come out this year. Last year's walk raised over $400,000. Joining us now to tell us the personal stories behind these walks, Stephen Henke from DAP Health. Good morning, Stephen.
Good morning. Good morning. We're starting to count down.
Yes. What do we
walk.
have? 2 weeks.
2 weeks.
Yes.
So there's still time for your viewers to register, walk, or donate.
Right. And last week we heard a personal story about a woman, a female who benefited greatly from going to DAP Health.
Absolutely.
And what are we going to hear about today?
So today we brought a story. You know, our theme is Walk Out Loud, and we're advocating for LGBTQ health equity. And, you know, when our patients and our clients are gracious enough to tell their stories, that's really what they're doing. You know, they're through their stories advocating by inspiring others to really understand what the journey from having no health care to being introduced to health care can look like.
Right.
Because I think sometimes it's hard for us to understand it. You know, if we have insurance, healthcare can be challenging and a little confusing. But when you don't have health insurance and you don't have an income and you might have challenges with housing or challenges with mental health care, you know, the healthcare system can be overwhelming.
Right.
And what I love about DAP Health, and one of the things that this walk funds, is the team at DAP Health simplifies that. For folks that are coming into our buildings and asking for help and having multiple challenges. They break it all down and they connect them to the care they need. And at DAP Health, mental health is health, housing is health, primary care is health. And so David's going to tell a story about his unique challenge and how he came into DAP Health and got the help and care he needed. All
right, let's hear David Jarvis's story.
My name is David Jarvis, and I'm a patient and client here at DAP Health. I came to DAP really depressed. I had lost a couple of friends. I lost my income, my house, my car, and I had to put both of my dogs to sleep, all within 6 months. I attempted to take my life twice, and a friend suggested that I call DAP. I came to DAP and met with registration and almost immediately became a patient. I was scheduled to see a doctor, and I went, and his nurse greeted me, and when she did, I started to cry. So I couldn't believe that I was finally going to get health care. I hadn't had health care for the year prior, and I was not well. She immediately went and got the doctor and brought him in, and he reached out his hand to shake mine, and I started to cry again, and I cried some more. I was so grateful that DAP was giving me health care. I was receiving health care at no cost. I continued to come. I continued to use the tools that he gave me, and I eventually was able to get a job. I started working, and my life started to turn around. I applied for housing here at Vista Sunrise, and I was 60th on the list. After several months, on a whim, I decided to go to the office to see where I was, and the manager said I was next. Next on the list was, you know, a godsend. I couldn't believe it. Summer was approaching, and I just couldn't bear another summer in that RV. I eventually moved in, and I'm working. I asked my employer to give me more work. I need more hours. So I'm healthier now than I've ever been, both physically and mentally, and I owe that to DAP. I'm alive because of DAP.
Wow. So I'm assuming that he had a lot of a personalized plan for him through DAP.
Yes.
Addressing all matters of health.
Absolutely. You know, DAP Health is so unique, and I think when you participate in the AIDS Walk, these are the stories that you're investing in, right? You're helping real people thrive and live real lives.
Right.
And, you know, at DAP Health, when you come in and you meet with a doctor, they're going to ask you questions about food insecurity, right? They're going to ask you if you are struggling with nutrition, and they're going to connect you with that kind of care. They're going to ask you questions about housing insecurity. You know, they're going to ask you questions about how you're feeling mentally, socially.
Right.
You know, and they're going to dig deeper to make sure you're connected to all of the services that you need to live your best life.
Yeah, because there are so many different components and compartments to health and life, and it seems like DAP addresses it all.
DAP Health does address it all, and I think the thing that I love about this story, and I really am so grateful that David shared his story, because there's so much stigma around things like mental health.
Right.
And I think anybody that's, you know, lived with any kind of a challenge, and I have,
right,
you know, it's hard to talk about it, right? And so I'm really grateful that he shared his story, because it helps other people, and it helps, I think, people that are thinking about walking understand that mental health is health. We can normalize these conversations and just get people the care they need and deserve.
Exactly. Please come out. Here it is. Walk Out Loud 2022 Desert AIDS Walk on October 29th, Ruth Hardy Park. Thank you for being here again, Stephen.
Thank you.
All right, we'll see you next week. Let's turn it over to Jerry for the weather.
Yeah, it's nothing like, you know, feeling alone and no one to talk to. So, yeah, another reason to join us in a couple weeks. Weather headlines. Yeah, a lot of sunshine today, maybe a couple mountain clouds. Could see a mountain storm as we move into the weekend. That same system will drop temps. How cool will it get? I'll have the answer just a couple minutes away. Keep it in.